Hello, just doing a little sound check here. Let me know if you cannot hear me. And I'm just going to go live on Instagram. Yeah. Okay. Hello, Instagrammers. Hello, Facebookers. People on Facebook, let me know if you cannot hear me. Anyone who's watching, can you just give me a little message? Just type comments. Let me know if you cannot hear me. I'm not sure which is the on or off or the mute button here on the microphone. And we are going to be starting in a few minutes. I'm just going to wait for people to join. Please type a comment, say hello. So we're just waiting for people to join before I get started. And anyone watching on Facebook, if you can just let me know if you can hear me, please. Thank you. Okay. So what are we here to talk about today? So today I am here to talk about C-section scars, what your doctor didn't tell you, and how massage can help. Okay, so that's the topic I'm going to be talking about today. So if you have any questions on Instagram or here on Facebook, please just type it in the comments. If I don't get to it during this video, I will respond afterwards. Okay, so I'm going to get started here on Facebook, since no one has said anything. Okay, so we're going to talk about C-section. So if you have had a C-section or you know someone that has, please share this with them because it's important information that I feel like is not being shared after people have the surgery, and I think it needs to be talked about more. So I'm going to introduce myself. It's been a long time since I've done one of these videos, so bear with me. My name is Nicole Nifo. I am a registered massage therapist, and I have been in practice for 15 years. My focus in massage therapy practice is working with women and children, specifically women as they're going through the perinatal cycle. So while they're pregnant or fertility treatments, pregnant, birth, and in postpartum. I'm also a birth doula, and I'm very passionate in working with C-section scars and helping people heal post C-section. So that is why I'm doing this video today. Any new people that have joined us, thank you. Just let me know if you cannot hear me. Just give me a little message here at the bottom and let me know if you can't hear me at any time, because I haven't used my microphone in forever. So what I'm going to do is I have a couple of things to talk about, and if you have questions along the way, please just type it in the comments and I will get to it either during this call or I will respond by typing back to you. So let's talk about the surgery. So I always like to compare C-sections to knee surgery. You might wonder why, because they're very opposite parts of the body, and one has to do with birth and one has to usually do with a repair or replacement of some kind with the knee. The reason why I compare the two is because I think that knee surgery is treated with more care and more prevention and more rehabilitation than a C-section. So when you're preparing for a knee surgery, you have a lot of appointments as far as like pre-op and post-op. You have physiotherapy planned for 6 to 8 weeks after your surgery. So there's a lot of care, a lot of exercises given, a lot of rehabilitation, a lot of empowerment and information to that patient so that they can make sure that their knee is healing properly and functional, because we need our knees, right? Because we're walking and moving. But something that I feel also is equally as important is our torso. It's our abdomen. So when you talk about a C-section, you're not just talking about major abdominal surgery, you're also talking about that person becoming a mother, whether it's for the first time or second time or third time. So with becoming a mother and you've been pregnant for 9 months and now your body is postpartum, there's a lot of its own rehabilitation that happens in postpartum, like hormonal changes, physical postural changes, adapting to life with a new child, sleep deprivation, all these things. And then you add on top of that major abdominal surgery. And I feel like there's little to no information given to women as they're healing. Hi, everyone. Thank you for joining. If you can't hear me, please just send me a message and let me know. I want to make sure that everyone can hear this because I feel like it's really important. So that's why I like to compare knee surgery to C-sections. So when you're talking about a C-section, majority of the time, especially here in Canada, I know things are a bit different in the US, and I'm not sure about other countries around the world, but in Canada, we basically are in obstetrical care or midwifery care of some kind, and we go into a C-section, either planned or emergency. And if it is a planned C-section, there's obviously some information given to the parent as they're preparing for surgery. But in postpartum, there's no information about abdominal wraps or taking care of your, rehabilitating your C-section scar or things that we should be doing to help our body as a whole recuperate after C-section. There's a lot of information about incision care and about getting like your digestive system moving a lot. So that's great. But then after that, so usually that's the first couple of weeks of care. And then after that, there's no more information. And if you're in care with an obstetrician, you're usually not going back in again until 6 weeks. So you're not even being monitored from that first surgery and then leave of the hospital until about 6 weeks postpartum. So unfortunately, that's why I think that C-sections are not held in the same regard as something like knee surgery. And it should be held even higher because you're not, like I said earlier, just dealing with somebody who has just had major surgery, but also has become a parent and is dealing with all those normal postpartum things that everybody else goes through. So we'll get to the scar massage information in a minute. I just want to go through the anatomy of a C-section, just so you understand what actually is being done. Because some people think, surgery, they're just cutting through, taking the baby out, closing it up, and you're done. But there's actually a lot of layers that are being cut into during surgery. And scar tissue is really important to help close the incisions. But then scar tissue can also create these adhesions and these points of being stuck between the tissue. And that's when that causes issues. So let's go through the anatomy of a C-section. I found this little prop. Someone else did online and I copied it. I thought it was a great idea. I apologize. I'm really short of breath because I'm 29 weeks pregnant myself right now. And all this talking, I feel like I'm losing my breath. Anyways, so here's our felt prop that I have. Those of you on Instagram, I will try to show you as best as I can because I have 2 cameras going here. So we have the first layer, which is the skin. This is usually one of the most important layers to most women because it's the layer they can see. And so if there's anything going on with this layer that they're not happy about, this is where the focus tends to be, okay? So like, my scar looks like this, or there's a belly shelf, or, there's a keloid. So whatever it is, a lot of focus for people who don't understand the depth of their surgery into their body, really focus on the skin. And this is kind of where I feel like our medical professionals are focusing as well. Of course, to help make sure that the incision is healing properly, it's closed, and that there's no worry and risk of infection. So we do want this layer to close, and it is an important layer. And it's something that you as a mom have control over because you want to make sure that this is healing well. But let's go a little bit deeper and see what else is going on. So once they've cut through that first layer, your skin, so it's usually a horizontal layer, by the way, unless for some medical reason or an emergency reason that they need to cut vertically, they will always cut horizontally. And to show you where they're cutting, I have my little pelvis here. So normally when you're pregnant, your uterus, this is the organ here, is a lot larger. So picture this uterus all the way up to here. And so this is your pubic bone. So they're cutting usually about at the bikini line, between the two hip bones. And they're cutting across that area. It's usually called the bikini line. And that's where they try to keep the incision. If you do need a vertical incision, they're usually cutting below the navel, so below the belly button, along the midline, down to that bikini line, okay? And some people have both. Some people have the outside skin layer has this, and then like their uterine layer or any layer underneath is vertical, okay? So we have this first layer here. Hi to everyone who's just joined us. If you have comments or questions, please post below, and I will try to get to it during this talk. If not, I will message you later. Okay, so our next layer is our fat layer. So what happens in this layer, again, we're getting another horizontal incision, okay? So we cut through that layer. And then you have more of a tough fibrous layer called the fascia. We have fascia all over our body. It's just a connective tissue, so it's quite thick. And again, we're cutting horizontally there. Then you have your ab muscle layer. Some people don't even know when they have C-sections if their abs are being cut into or not. And actually, they are not cutting into your ab muscles. What they do is actually separate them and push them apart, okay? So there is still a bit of trauma to them because they're having to separate and push them apart, but they're not actually cutting into them as they would the rest of the layers, okay? So this is pushed apart here, okay, down the center. Then you have this next layer. It's like a thin lining of the abdominal cavity. It's I should have gotten like a see-through material because that would have actually shown it better. And it's thin and it's just the lining. Okay, so here they're actually cutting vertically. Okay, and then you have your bladder here, and this they're just pushing down. Okay, so they push the bladder out of the way. I'm actually going to take it out of the way. And then you have your uterus. Your uterus is a organ muscle, so it's a smooth muscle, and it's what the cavity that your baby has actually been growing inside of. So this is the uterus here, and it grows really, really large to be able to house your baby. And this is the one that's giving you the Braxton Hicks contractions. It's the one that you're actually getting contractions in during labor. And so anyways, this is the uterus. They're doing a horizontal incision there as well. Then you have the amniotic sac. That's the sac that the baby, all the fluid is inside and is housed in there for safety. So again, they're going to cut into that. And then you have your cute little baby. Like my drawing? I'm not an artist. My husband and my child are, but I clearly missed the ball on that one. So just to kind of recap, if I were to piece all of these pieces together, and we were to pretend like this is the layer of your abdomen, you have to look at all of these layers just to get to your baby. I'm not even at the baby yet. I'm getting there. Hold on. Okay, just to get to your baby, all of these layers. So when we're looking at the anatomy of a C-section and scar tissue, you can't just focus on what the skin looks like on the outside. A common thing that I hear is, oh, it's okay, like my scar here healed great and you could barely even see it now. That's amazing. I'm so happy for patients who barely can see their scar and don't have a lot of trauma on the outside, because I know it can be something that people are very insecure about, especially if they're wearing bikinis or they're in front of their partner. I think that's great. But what we really have to look at is the functionality of our scar, a functionality of your C-section scar, because that's what is going to predict your health and wellness as you are growing and aging, okay? And for future births and pregnancies. So why is scar massage so important? So I have 3 points to make here, okay? If you have any questions, please post them. Share this with friends that have had C-sections, because this is so important, this information. I did link my C-section support group on here that I have. I have almost 500 members from all over the world joining and asking questions in regards to planning or preparing for C-sections. Clearly, there's not enough support in our medical system for this birth surgery. So I really believe that, you know, we need to share more positive information about this to help support people. Okay, so why would you massage your scar? So the first one that is really important to me and I actually work on in my massage therapy practice with all my patients is the first one I work on. And that is, it helps us to connect to the physical trauma our bodies have experienced. So whether it was a planned or an emergency C-section, there's still physical trauma to your body. They're cutting through your layers of your body to get to your baby. And some people might feel, like it was fine. They were happy to have had the surgery because they know their baby's safe and then they were safe. But then there's a lot of people who don't feel good about their surgery. And I think that it's important to heal the body and heal your experience from birth. It's important to touch your scar. So it's helping you to connect to that physical trauma. I have massage therapists. I have people who've had like multiple births that have never touched their scar. That's the first thing I ask somebody if I've known they had a C-section. I say, have you touched your scar? And a lot of people say they haven't. Some people are grossed out by it. They tried once. It made weird noises. I don't know how your scar can make noises, but that's what they told me. I had another woman say that she has to have a couple of drinks before she even does massage on her scar, which I felt was really sad because it's her body and she shouldn't have to be intoxicated to massage her body. But clearly there's trauma there, right? I've had people, what else? They just like, they're grossed out by it. It's just a part of their body they like to ignore. And I definitely think that through touching it, through massage, it's something that we can actually heal ourselves through. I'm just going to go to a quick comment here from Lori, who was my doula. I'm hoping to change the language to be cesarean birth versus C-section, so we're honoring and acknowledging that all births need to be honored and respected. And I 100% agree with you, Lori. The only reason why I use the word C-section is when I'm specifically talking about surgery and if I'm trying to share information, because I feel like cesarean birth is not as searchable. And so when you go online and you search up cesarean birth compared to C-section, more people are typing in C-section. But I 100% agree. When I talk about my own birth story, I say cesarean birth. I've even liked the term belly birth. But I definitely feel like when people are just talking about C-sections as the way that they gave birth to their child, it takes away from like that emotional, like you said, to being honored and respected that it was actual birth, because it is. And for me, that's the only way I can birth my babies. So, that's a part of why I'm so passionate about educating people about cesareans, because there's a lot of stigmas. So definitely the language is so, so important. Okay. I love that you mentioned that. The second thing. So the second reason why I think that scar massage is very needed is because it helps to create movement in the tissues that were cut into. And also in the surrounding areas around the tissue. So if you look at, your outside, your scar on the outside of your skin, this has to create scar tissue so it can close, which is so important. But then also what happens is underneath, between, let's say, these two layers, we can have scar tissue developing and adhesions developing in between these two layers. And the same thing can happen all the way up to your uterus. And the problem with that is that it creates restriction. So I've had patients that say they feel pulling in their uterus. I have patients who say they have back pain. Something you have to remember when you're healing from surgery, you're more hunched forward. So you're more in a flex position. And when you're in that position healing, you're creating a lot of shortening in your torso. And so when your scar is forming and you're very shortened, okay, now maybe you're like a couple of weeks postpartum, but now you're holding a baby and you're feeding. So I feel like it's like a very forward posture is something that's very common in postpartum. But your scar is forming then, and it's forming with very shortened tissue. So, now we have people with back pain and neck pain that could be related to their scar. And not having all of those layers of tissue not being able to move freely within your body can create issues down the road. I work with patients who are 30 years postpartum, and their pelvic physio is working with them for incontinence, which is where you can't hold your urine, you can't contract your muscles in your urethra to hold your urine in, and so or overactive bladder. And when you look at the uterus layer and you look at how close, I need to glue these guys together. And when you look at how close and how they kind of sit on top of each other, your bladder and uterus, you have your scar that's being formed here on your uterus. And then you also have scarring that can happen between the two organs here because they're so close together. So now we can start having bladder issues. And so the therapist will send their patients to me for scar massage because we're helping to release the scar, which will then in turn help to create more movements in the organs and not so much restriction. Another one is the chronic numbness in the skin. So very common. I actually don't have any numbness from my first cesarean because I did some research and found that if you use a couple of different textures around the skin of your scar, you can help to resensitize the scar and help the nerves to grow back. So I have no numbness. So I'm planning to do it again. And some of the things I suggest for that would be like face cloth, like one of those dry brushes, or like if you have a kid who has like the natural bristle brush, and then even like a comb, like a man's comb, would be the next layer of material that I would use. And what you're doing is you're basically massaging all around your scar to help to desensitize the skin and help bring back that nervous system in the skin layer to help with the numbness. So those are some really like important reasons why you want to do massage to your scar. And then third, the one that seems most important to people, and that is the skin layer. That is the look and feel of your actual scar. So a lot of times people will complain about their scar, maybe puckering maybe at one end and kind of looking a bit bunched up where the rest of it looks nice and smooth. That's definitely an indication that there's some scar tissue restrictions going on with the first couple of layers of tissue in there. A lot of people complain about the belly shelf, and it's kind of, if you've never had a cesarean before, then it's where basically your belly fat just kind of hangs over your scar. So a lot of times, like if you've had a little bit of belly fat before having children, it just kind of all looks together. But once you've had a cesarean, it kind of like is almost like tight, and then your belly fat just hangs over. I mean, some people live with it and they just say, hey, that's part of having a mom body, or it's just part of like, being a mother, and, it happens. And others are very insecure about it and will actually contact me and ask me questions on how they can help get rid of it. I mean, if you work on reducing your BMI, your body mass index, and working on, decreasing your body fat percentage, you can definitely help with that. But massage would definitely be a great way to help with the actual look of your scar. There was a study done in 2013. I can link it here. And on Instagram, I can link it as well. There was a study done in 2013 by a massage therapist. She was looking to see if scar massage can have an effect on hip pain, and also if scar massage can help change the look of a scar. Now, she didn't see a big change in the pain on the person's hip, but she did see a huge change in the actual look of the scar. That was part of her conclusion. So, and even just in my own clinical practice, I've seen huge changes in people's scars physically. If you're going and talking about hypertrophic scars or keloid scars, you may have to consult with a surgeon to have especially the keloid removed. I know a patient of mine told me about seeing a dermatologist and having some kind of steroid injection into it. Either way, I still think massage is important to incorporate. So I don't think, going to get the injection into your keloid scar is going to free up all of the scar tissue. Going for tummy tucks, any of that stuff, I think manual manipulation is really important to really free up that tissue. So that's kind of it for today. That's what I wanted to talk about. And if you have any questions, please post them below on Instagram. You can message me as well, and on Facebook. I have linked our C-section plan support and recovery group. We talk everything cesarean birth. I'm very protective over that group, so everything has to be approved by me before I let the group see it. As far as posts, and all the questions have to be answered that are asked before I let anyone join. I really want to keep it as like a safe space for people who are planning for cesareans, because there's just not enough information out there. And I think the more of us that advocate for cesarean births, if it's the only safe way people can have babies, then we need to normalize it and advocate that it is important for recovery and for preparation, that people feel that they have the support. So thank you very much. Oh, I forgot to mention, baby brain happening. I forgot to mention, I am coming out with an online program. It's called the C-section recovery method. And that's coming out before the baby's born, so before the spring. But aside from that, so that's a program for the first 6 to 12 weeks postpartum. I have another mini program coming out sooner, which is a guidebook and a video on actual scar massage. So if you are somebody who is a few years postpartum, or even 6 months postpartum and wants, or even 30 years postpartum and wants to learn how to do your own scar massage, maybe you don't have someone locally that you know or feel comfortable having anyone else do the massage on you, this video will help empower you with the tools and the information to do your own scar massage and take care of yourself. So that's going to be coming out very shortly. And if you have any questions, please let me know, and I'm happy to talk about it. So I will be on again next week. I'm doing this every week until the baby comes, at least. So if you have any questions, you want me to talk about certain topics, please post them below as well. Thanks, everyone. Bye.